Tummy
talking
talk.
about tummy talk. So
Okay.
tummy tucks, there's
Tummy
tummy
talk.
talk.
All
These
right.
are questions you can just basically touch on, like people asking what's the difference between a full tummy tuck versus mini tummy tuck, all that type of stuff.
Okay, everybody joining in. Where are you guys from? Let me know. I'm here at Beverly Hills. And can we see the palm trees? We got to always show the palm trees when we go live. There we go. Boom. All right. I'm Dr. Barrett. I'm a board certified plastic surgeon here in Beverly Hills. We are going live. We're going to talk about tummy talk, tummy tucks, mini tummy tucks versus full tummy tucks. Minnesota in the house. Hello. There's something in Arabic. My Arabic is not as good, but welcome. Hi, Doc. Hi from Fresno, California. Nice to meet you. I've got a big fire ambulance behind me. Just make sure everything's okay. It's okay. We're no big emergency nearby. Let's see. I see somebody from Fontana. You know, I used to moonlight at Kaiser Fontana out there. So what's up, Fontana in the house? We've got India, Mumbai. Well, that's pretty far. Canada. We've got, who else? Hi, Dr. Michigan. And we got Atlanta, Georgia. Mia Flores, welcome. UK, what's happening? Anybody from Germany? I'm going to be out there for the Berlin Marathon in September, so make sure you cheer me on. I'll be doing the LA Marathon this year as well, so if you're out there, I'll be wearing some bright orange shorts. Make sure you cheer me on there. Hi from Italy, what's up? You guys, we're going to talk about, real quick, we're going to just go into, this is tummy talk. All right, we're going to talk about tummy tucks and the difference between a full tummy tuck and a mini tummy tuck. Man, I'm looking skinny. I'm trying to cut weight for the marathon. That's it's one way to avoid a tummy tuck, but you know, not gain too much weight. But if you do, you have kids, that's fine. We can take care of it. So I want to go really quick into what is a full tummy tuck. A full tummy tuck is where we make an incision. A mini tummy tuck, we also make an incision, by the way. And a full tummy tuck addresses the skin above the belly button. Okay, so if you look down at your belly button, you see that it is a sad face. It's kind of hanging down and over. And you go like this, and you're like, oh, it's so much better, right? Then you need a full tummy tuck. The main reason why is because a mini tummy tuck generally doesn't release the belly button, okay? Full tummy tuck releases the belly button so we can pull that all down. I just did one today. So by the way, if you want to check it out, go to my Instagram, drdanielbarrett.com. I'm sorry, that's my website. You can check that out too. But go to if you want to see the surgery I did today, it's at Instagram at drdanielbarrett. Okay, so check that out on my stories. So if you need a full tummy tuck, you're going to know by the way the belly button is. And the full tummy tuck will allow the skin to kind of drop all the way down. And then so it's like the belly button goes down like a periscope and then comes back up into the new skin. It's the only way to get rid of all of that extra skin. We can also do application at the same time. There is a way to do application with a mini tummy tuck. A mini tummy tuck only addresses the lower skin. So if you just have a tiny little poochy skin down here, you can get a mini tummy tuck. But a lot of times if you overdo it, it pulls the belly button down and can make things look worse. So I'll tell you, I can count on one hand how many mini tummy tucks I've done, and it's probably been over 1,000 full tummy tucks I've done. Okay, so there's the key with a really good tummy tuck is to make sure that it looks natural and real. You don't want to go to the beach. I went to this place called San Vito Beach in Sicily, and it's like this locals place. We were the only Americans there that I was aware of. And first of all, back then Americans didn't even go to Sicily, so there was just European tourists. And now there's like Americans going there. What's that show?
Where?
About Sicily? No, it's about Sicily.
Oh, White Lotus.
White Lotus.
White Lotus.
Anybody watch White Lotus? Anyway, Sicily, highly recommend it. It's a great place to visit. It's a little more authentic than some parts of Italy. I haven't been to all parts of Italy, but some people say that it's like what Italy used to be. We had a great time. So anyway, San Vito Beach, I was there, and we were out at the beach enjoying some sunshine. And man, there's people out there smoking cigarettes and just like super tan. And I'm like, these people love the sun. They love their bodies. And I would suggest to not have so much sun in your life, but that's your prerogative. And I was looking around at all the tummy tucks that like people's tummies, and I could see there was this tummy tuck that was going around. One doc in San Vito Beach or wherever was doing this tummy tuck with a super high incision. So these women had this high incision, and their belly buttons look a little bit like coin slots. I'm like, okay, well, it looks better. But, you know, it's like I can see from a mile away. Most people could probably see that, oh, you had a tummy tuck, and maybe they don't care. But, you know, there's ways to do a tummy tuck to make it look natural. Okay, so if you go down lower with the incision, there's a specialized technique that I do, incision lowering stitches that lower the incision down. I did those today during my surgery. And then you have to spend a lot of time on the belly button. I've developed some techniques to kind of tether the belly button in so that it looks like an innie, and it brings a hood on the top and a little gentle ramp on the bottom so that it looks like a natural belly button. So it just takes someone who really understands anatomy to make it look right. If you're in San Vito Beach, I will give you a discount on your tummy tuck. Come see me. All right. We need to stop the bad looking, unnatural looking tummy tucks. Okay. So is there a lot of pain after surgery? Well, after the tummy tuck, there's a couple hacks that we have, and this is something you should ask your doctor if you're going to get a tummy tuck. Long-acting injectable that we can inject into the plication. The plication is the most difficult part. Do you want to grab the plication sheet? It's in one of the consult rooms in the drawer. It talks about the tummy. I want to show you guys this because it's really important. And that's half of what we do with a tummy tuck is like if you have like 5 kids, your abdominal muscles, they stretch out and you have this space in the middle called rectus diastasis. And part of the tummy tuck is we get to fix that. We get to bring that back together. And I had a patient yesterday, actually. She came in, she was so happy. You know, she was pretty small, but she was having urinary incontinence. She could not run. And one of the benefits that I've found by doing this plication is that it helps with pelvic floor issues. It orients everything into the lower pelvis and tightens everything up. Okay, here's an example of what rectus diastasis looks like, okay? So you can see right here, there's a wide space right here. And what we do to fix that is we do a suture. I do a double line suture right here, okay? And that brings these 2 sections back together. You can watch that on my stories today. Actually, it's probably on my Snapchat. I've been rocking into Snapchat lately because I can show more details if you guys really want to see it. Later today, it's Barrett DM, B-A-R-R-E-T DM on Snapchat. So B-A-R-R-E-T DM on Snapchat. I don't really push you guys there very often, but it's kind of cool because I can actually show more of the details of the surgeries. So that plication I found that it really helps with a lot of women with pelvic floor issues and urinary incontinence. There's no studies on that I'm aware of yet, but it's been true in a lot of my patients. And the patient I saw yesterday, she was super happy. It also cinches in the waist, tightens your core, makes it flat from the front. Because you ever see those people that are just really, really skinny and all of a sudden they have this little pot belly? It's probably because they have the abdominal wall laxity or rectus diastasis from either weight loss or pregnancy. So that's part of a tummy tuck, okay? Now, when we inject the numbing medicine called Exparol, lasts for 3 days. We do it right in that plication. That's the most painful part. We also do it everywhere else, but that's the most painful part. And if you numb that up, you don't need any pain medication for 3 days. I also recommend alternative pain medications like CBD, magnesium. You can check it out on my website, postoprecovery.com. I have all of these supplements. If you're going to get a tummy tuck somewhere else or a plastic surgery procedure or actually any kind of procedure, surgical procedure, you should check out that website. All those products are really good for recovery. I've handpicked them out so that you guys can benefit. And we don't really make a whole lot of money off of it, but it's just there as kind of a resource because we offer that for all of our patients. Because if I were getting surgery, these are the things that I'd want. Okay? Does insurance cover tummy tucks? Sometimes. It's really hard. What they cover is what's called paniculectomy, and that's just removal of the skin. They don't cover the tightening of the muscles on the inside. Insurance companies are pretty annoying in general. I think they're a big scam, but they can sometimes be persuaded if you have massive weight loss. We're talking like 100 pounds to cover a paniculectomy, all right? So that is something if you're curious about. You can investigate with your insurance company. Can you do surgery to get rid of a fupa? Well, a fupa is a fullness of the upper genital area, okay? And a tummy tuck can help with that, okay? So it really matters. So sometimes if you have excess fat, simple liposuction will work, but you might need to actually do a pubic lift. And so I do that a lot of times as part of my tummy tuck procedures so that it's not kind of all like full down there and it kind of matches the rest of the tummy tuck. So yes, you can do something about that. How do I know if I need lipo or a tummy tuck? If you have to ask that question, you probably need a tummy tuck. But I'll say this, look at the belly button. If your belly button is circular and round and you don't have a sad face with the skin hanging over, lipo will probably be okay, all right? If you've had a pregnancy, you're probably gonna need a tummy tuck. Not all the time, but many times. Now remember, liposuction doesn't get rid of all the extra skin, it gets rid of the fat, okay? It doesn't get rid of the extra skin. So I'm running out of time, I just looked at the clock. All right, so I got one more question for you guys. What if you've had previous surgery with mesh? Well, I had a patient last week who had mesh in from umbilical hernia, and we were able to remove it for her. You guys, I gotta go. I have to get, speaking of insurance, I have a meeting with insurance company, so software, so I can bill insurance. So that's what I gotta do right now. But we're going to go live next week, and we got some fun TikToks come out, so make sure you follow me on Barrett Plastic Surgery for TikToks, and get me on Instagram at Dr. Daniel Barrett, Dr. Daniel Barrett, where we have a lot of interaction, DMs. And if you want to see more in-depth videos, make sure you check out my YouTube, Dr. Barrett Plastic Surgery on YouTube. We got Claire in the background. I'll give you guys a little intro. She's been working on the videos. What's up? All right, and then we got everybody else, Zach, and the whole team in here. So check out that stuff. And if you want to get a consultation, it's really easy. You can call right now. We have Ashley answering the phone right now, 310-598-2648. Just call us, give you a consultation, or you can do a virtual one on my website, drdanielbarrett.com, and find a little navigation to virtual consultation, okay, so resources for patients. And you can submit some photos and some information, and we will get back to you. Thank you, guys. I hope you guys have a wonderful day. We'll touch base maybe this weekend, but definitely next week. Talk soon.